Non-nursing medical jobs you need to look into today. What's up, you guys, and welcome back to my channel. For those of you who are already part of the family, for those of you who are new, welcome. My name is Kiara Selena. I'm a licensed practical nurse, and on my channel I mainly make nursing related videos, but I also do beauty and hair videos. Love helping people and you've determined that you want to work in healthcare. So you start doing your research, and the first thing you probably research is nursing. I mean, nursing is the hot topic now. The demand for nurses has skyrocketed like never before. You can become a nurse relatively quickly and the pay is pretty good. But after doing your research for some time, you realize that for one reason or another, nursing is not for you, but you still want to work in healthcare. I've come up with 5 non-nursing medical jobs that you can do that are pretty comparable to nursing in terms of program length and salary. Just a disclaimer before I start, this may not apply to your state, this may not match your experience. This is based on my research and the average in the USA and Canada. 1. Radiology technician. So radiology technicians usually work with x-ray machines that are used to scan things like bones, tissues, and organs to find any signs of injury or signs of illness. It usually takes about 14 months to 2 years to get this done, depending on if you do a diploma or degree program, because you can get your associates in this, and they usually make between $42,000 all the way up to $60,000 a year. 2. Occupational Therapist Assistant. Now, some of you have probably never heard of this, but OTAs work very closely with OTs who are occupational therapists. Now, their jobs are kind of similar, however, the time they spend in school is uncomparable. An OT usually does a 4-year master's degree, where an OTA will usually do a 2-year associate's degree. Now, the difference between the OT and the OTA is kind of comparable to an RN and an LPN, I guess, in a way. An OT is the one who will really do the first assessment, the evaluation, and who will pretty much develop the care plan and set the goals for the patient. And the OTA is the one that will actually perform the therapy with the patient. So they work very closely together. Their jobs are similar, however, the time they spend in school is different, and the OT obviously has more of a leader role in that team. OTA is a 2-year associate's degree program, and they make on average a good $60,000 a year. Physiotherapist Assistant. Now, this is kind of the same concept as the OT and the OTA. The PT or physiotherapist is the one that will actually do, like I said, the initial evaluation, assessment, the one that will develop the care plan or set the goal for the patient, and the physiotherapist assistant is the one that will actually do the therapy with the patient. Once again, their jobs are kind of close, and a lot of times patients will say that they didn't even really notice the difference between the PT and the PTA, but obviously the PT also does a 4-year master's degree, whereas the PTA does a 2-year associate's degree. So obviously in that team, the PT will have more of a leader role. And with that being said, a PTA makes pretty much the same thing as an OTA, and that is $60,000 a year on average. 4. Medical lab technician. Now, this one is really good for those of you who enjoy working in labs or who enjoyed chemistry maybe in high school or college. Medical lab technicians will pretty much just evaluate bodily fluids and tissues to look for signs of illnesses. Now, this is a 2-year associate's program, and they usually make between $52,000 all the way up to $65,000 a year. Lastly, for number 5, we have radiation therapists. Now, their responsibility is to treat cancer patients with radiation therapy or radiation treatment, however you want to call it. They work very closely with oncologists and oncology nurses, and for them, it is a 2-year associate's program as well, but they make a lot more than all the other jobs that I mentioned. They can start at $70,000 and go all the way up to $82,000. 5 non-nursing medical jobs for those of you who know you want to be in the healthcare field but know that you do not want to be a nurse. These jobs, like I said, are pretty easy to get. I mean, the programs aren't too long. They're 2 years, which is well, 14 months to 2 years, which is pretty much how long it takes for you to become a nurse, whether you go LPN or RN. In Canada, the LPN program is 2 years. So if you're here, it takes pretty much the same amount of time, and they pay pretty well. I mean, the salary is very comparable to a nurse's salary, like I said in the beginning. So if you guys are interested in this, go do some further research. These jobs are really, really cool. And with that being said, I hope you enjoyed this video. If you did, please like and share. And if you want to see more content like this, please hit that subscribe button and turn your notification bell on so you won't miss no future videos from me again. I hope to see you guys in my next one. Bye.